Oh, really?
Today, no, I have not seen it.
Oh, okay. Yeah. How are you? My babies, I'm trying to worry.
The Mississippi Department of Human Services, Mr. Bob Anderson, along with him is Mark Jones and Alex Bucklew. We have a 2 o'clock as the House of Representatives does have to go back to work, so we'll go ahead and get started. The Senate has the rest of the day off.
Thank you, Mr. Chairman. I'll try to get through with these slides as quick as I can. I want to introduce just 3 other folks that I have over here at this table. Alex Bucklew is at the end. He's our legislative liaison. To his left is Wayne Carpenter. He is our deputy for administration and finance, deputy executive director. Next to Wayne is my principal deputy executive director, Sandra Griffith, who also serves as our inspector general. And then just to her left is Rochelle Richardson. Rochelle is our deputy executive director for age-related programs because she has Division of Youth Services, she has our child support program, and she has our Division of Aging and Adult Services under her supervision. So this is all the team that we have with us. Mr. Chairman, I want to thank you for the opportunity to speak today. I'm going to try, to the extent that I can, to walk through all of the 7 programmatic divisions that we have at the Department of Human Services and tell you just a little bit about what they do. You have these slides in these packets that are in front of you. The 7 programmatic divisions that we work through are the Division of Early Childhood Care and Development, the Division of Economic Assistance Eligibility, Division of Workforce Development and Partnership Management, the Division of Aging and Adult Services, the Division of Community Services, the Division of Child Support Enforcement, and then the Division of Youth Services. And I'm going to talk just briefly about each division just to give you an overview of what those divisions do. So, Early Childhood Care and Development. This provides services to children and families all across the state of Mississippi through our child care payment program. And that program issues certificates to families receiving TANF and families that are experiencing homelessness, families that are caring for foster children, working poor families, students or individuals with special needs. How do you qualify for one of our certificates, also known as a voucher? The vouchers are available. First of all, a parent has to be employed 25 hours per week or enrolled in a full-time education program and with an income that does not exceed 85% of the state median income. Now, this has a monthly amount. If you do the math, it comes out to about $38,000 for a family of three would qualify for one of our vouchers. Last year, our child care payment program provided child care assistance for over 40,000 Mississippi children. That is a significant increase. Back in May of last year, we eliminated a child support cooperation requirement that the Early Childhood Committee recommended. We eliminate that child support cooperation requirement, and our number of vouchers has gone up about 10,000 since we did that in May of last year. The child care program receives about $121 million in federal funds each year, $6 million in matching funds are required to draw down that federal money. And we also, in order to keep our enrollment, our number of children where it is right now, we have converted $25 million in TANF funds to child care development funds in order to continue to service all the families that we have using our vouchers. Now, last year, well, actually 2 years ago, we were favored with some direct ARPA funding. It was child care specific that was awarded to the agency. And we are using that ARPA money to do several things to improve both the quality and the availability of child care. We have raised up about 14 resource and referral centers all across the state. Those are available. Any parent who wants to can walk into one of those resource and referral centers, and several of those are located on the campuses of some of our community colleges. We're looking for a location for one in the metro area. There has been one in the 750 North State Street building where CPS is housed, but they have asked for us to give that space back to them, so we'll be moving out of the 750 North State Street building and finding a new location for a resource and referral center here in central Mississippi. Wonder School is one of our partners that we're working with these ARPA initiatives. Two things they are doing we received about $199 million in ARPA funding. One of the things that Wonder School is doing is they have created a substitute teacher program. Every child care facility faces the possibility of having to close if they don't have full staffing. And so these substitute teachers are available to any participating child care payment program provider. All they need to do is call and request a sub. So far we have about 80, I believe, who are available to child care providers. We also have targeted $4.9 million toward helping new child care providers launch a child care business, and offering technical assistance to them to be able to get into the child care business for the first time. Some other things we're doing with the ARPA initiative money that we have. Child care workers, as you may know, some of you may or may not know, are they're not the best paid in the state. In fact, they're some of the lowest paid employees. Many of them work around the minimum wage. And we have committed $83.4 million toward paying direct stipends, direct incentives to child care workers. These funds are available through September 30th of this year. We also created a scholarship program that's being administered through the Horn Group to allow individuals who are employed in the child care industry at one of our providers to pursue either an associate degree or a 12-week certificate in childhood development. And we have committed $3 million toward that program. One of the requirements of that program is if you get a scholarship, you must make a commitment to stay in the child care business for at least one additional year beyond the scholarship year. And then during the pandemic, as many of you may understand, a lot of child care facilities had to take in school-age children. Generally speaking, they're not eligible to be reimbursed for school-age children if they're operating as a child care facility. But we are committing, and that number is actually incorrect. It's not $3 million. We are committing $25 million to reimbursing child care providers who took school-age children into their facilities during the pandemic, just to reimburse them because they were not able to bill us for those during the pandemic. They were not able to bill or be reimbursed for school-age children who were out of school due to the pandemic. All right, our next division is actually our largest division, the Division of Economic Assistance Eligibility. That division administers a number of federal grant programs to support some of the most vulnerable citizens across the state during times of crisis, and with the objective to try to move them toward economic stability and self-sufficiency. Economic assistance eligibility has about 800 or so of our 1,700 employees right now. So they administer the Supplemental Nutrition Assistance Program, which most of you may recall was formerly called the Food Stamp Program, and that delivers monthly food benefits directly to low-income households. We passed through to families about $837 million in SNAP benefits last year. That benefited over 400,000 individuals. I think the number of families was about 200,000 families that benefited directly from that. We also have I'm getting ahead of myself. Let me back up a slide. Sorry. We also administer the Emergency Food Assistance Program. That helps just supplement the diets of low-income citizens by providing them with emergency food and nutrition assistance. This is through our food pantries primarily. And we have about $1.6 million in funding for the Emergency Food Assistance Program. Another one of the programs that Economic Assistance Eligibility administers is our SNAP Education Program. And it is designed to educate families on making healthy food choices and choosing active lifestyles, basically to make them healthier through better food choices and through being active. We have about $5.5 million in federal funds that supports the SNAP Ed program. And then we have the Commodity Supplemental Food Program that is primarily designed to help elderly persons. And elderly here actually is defined as anybody 60 years or older, and it supplements their diets as well with more nutritious foods. We have $1 million in the CSFP, as we call it, the Commodity Supplemental Food Program. Next, for economic assistance, they administer the Temporary Assistance to Needy Families Block Grant, which provides both direct cash assistance and funding to private, public, and faith-based subgrantees that we partner with. We receive an annual grant from the Department of Health and Human Services of approximately, the Federal Department of Health and Human Services, approximately $86 million. And the current distribution of those funds is about $6 million is going to direct cash assistance in the form of monthly support payments. $29 million is used for the child welfare program by Child Protection Services. $25 million, as I said earlier, we have converted to the child care payment program to continue to pay the vouchers for the families that are eligible for our program. And then we're using about 26 million of that for various sub-grantees that are doing a number of programs. They're doing workforce training and education programs. They're doing parenthood initiative programs. One of the tenets of TANF is promoting two-parent families. I'll get to that in the next slide, but we use a lot of our sub-grantees to do parenthood programs and after-school programs for families who are on our eligible for our TANF program. There's also a maintenance of effort requirement. In other words, we have to show that the state is providing 21.7 million of similar services to the TANF funds, and that's based on a formula that was developed all the way back in 1995 when the first TANF year grants were awarded. We have to meet a work participation rate. It's actually 50% is the minimum. We're a little behind that right now. We're trying to get to that work participation requirement. In terms of what TANF requires, these are the 4 statutory goals of TANF. These are the only ways TANF money can be spent. It can be spent for direct cash assistance to families so that children can be cared for in their homes. It can be spent for ending dependence of needy parents through work, job preparation, and marriage education. It can be spent for reducing the incidence of out-of-wedlock pregnancies and promoting the formation and maintenance of two-parent families. Number 3 and 4 don't have an eligibility threshold. In other words, any family can benefit from the programs we offer for reducing the incidence of out-of-wedlock pregnancies and promoting parenthood in the form of two-parent families. Our sub-grantees that we work with offer programs directed to all 3 of the additional TANF purposes. All right, our Division of Workforce Development, as you might imagine, it's in the business of trying to get people to work, get people in the workplace. We collaborate with county leaders, local workforce directors. We are constantly trying to sign up employers to be partners with us. Community colleges are partners with us, and other community-based organizations like planning and development districts, trying to do the same kind of work that Accelerate Mississippi does, and that is get people into the workforce so that they can begin that path to economic stability and self-sufficiency. And our workforce development and partnership management program is funded both by SNAP dollars as well as TANF dollars. We have a SNAP program called the SNAP Education and Training Program, and then TANF does workforce training and other supportive services designed to get people into the workforce. All right, the next division I'll talk about briefly, Division of Aging and Adult Services. I always like to talk about this one because it has the simplest description. In order to be eligible for our aging services, you have to meet 2 qualifications. You have to be 60 years or older, and you have to be breathing, basically. That's it. If you're 60 years old and you're alive, you're eligible for these services. And we have quite a bit of help that's available to senior adults. 60 doesn't sound too senior to me these days since I'm a couple of years past that, but 60 years old is the eligibility age. We have the State Health Insurance Assistance Program. You know, one of the toughest things for families to negotiate when you get to age 65 and you're eligible, 62 when you're eligible for Medicare, Medicaid, is figuring out what you need. Do you need Medicare Part A? Do you need Part B? Do you need Medicare Part C? What is Part D? What does that drug program look like? And our state health insurance program helps families and individuals negotiate becoming eligible for Medicare or Medicaid. I misspoke a moment ago. It's Medicare you qualify for at 65. It's Social Security you are eligible for at 62 or older. Now, we have the access to care centers scattered all across the state. These are primarily designed to help elderly individuals and their families who have disabilities find long-term care services and find supports if they want to stay in their home, find supports to stay in a home-based setting. And we have a tremendous amount of assistance available. We served, as you see, over 22,000 individual clients in the last fiscal year. We also do home delivered meals. We provide these directly to the homes of those who participate in our programs. During the pandemic, we did only home delivered meals. We have gone back to doing congregate meals as well in community centers, but we delivered about 1.5 million meals to homes, and about 4,300 individuals also received another 450,000 meals in congregate feeding sites, such as community centers or other community sites. We have a homemaker service available. We also have a respite services program. If you have responsibility for full-time care for a senior adult in your home, and I can relate to that, having a 93-year-old mother-in-law that lives with me these days. For 4 years now, we've had full-time care of her. Our respite care program allows you to hire a caretaker to give you a break from that full-time responsibility. And our respite services program will provide a voucher of just under $600. We keep it under $600 so we don't have to generate a 1099 and file a 1099 for everybody. But about $590, you can get a couple, 3, 4 days, depending on what your caretaker charges, of assistance where you and your spouse can take a break from that full-time in-home care and have a caretaker come into your home and help you for a little bit. Last year, we provided 96,000 hours of care to about 389 individuals who asked for that respite services assistance. And then we have a transportation assistance program where we offered about 2,800 individuals over 228,000 rides to get to various different services, from doctor's appointments to grocery purchases to any other kind of needs that they had. I will say, among all of our divisions, and I get in trouble if I say any is my favorite, but I will say in terms of their attitude toward the population that they serve, our aging division is number one. They love working with senior adults, and they are top-notch in what they do. They look for opportunities to be out in the community. You may see them from time to time, at least until the Braves leave us. You'll see them having a baseball night out at Trustmark Park, and they'll have a table set up and they'll be promoting all of these aging services that they do. They go out and do town halls, and they do community visits to help people sign up for Medicare and things like that. They love serving senior adults, and they are by large, I'm not trying to step on anybody's toes, but by a large measure, they are the most enthusiastic group of people I've ever worked with, and it's a pleasure to have them as a part of our agency. We also have the Adult Protection Program that's part of our Division of Aging. Unfortunately, not every senior adult in his or her home is treated the way they should be. And we have instances of abuse and neglect and, sadly, financial exploitation that happens. We get calls. We got over 11,000 500, 600 calls last year, resulting in over 7,200 reports for investigations, and sadly, over 4,200 cases of abuse or neglect or financial exploitation were substantiated. Our investigators in our Adult Protective Service, if the case is egregious enough, they will refer that to the local district attorney's office, and we have had cases that resulted in prosecution. As a former prosecutor myself, I can tell you, when I was in the Public Integrity Division at the Attorney General's office, I had the responsibility of prosecuting some of these financial exploitation cases, and it is really sad to see what happens to senior adults when family members decide that the money, their inheritance, is theirs to take right now and not wait until mom or dad is no longer with us. For our senior adults who are in the nursing homes, and there's a large population of them, we have the Long-Term Care Ombudsman Program. And that program exists solely to be a voice for residents in our long-term care facilities. They advocate for those residents because they can't, a lot of them literally cannot speak for themselves any longer. And we have regional ombudsmen all around the state who have responsibility for making regular visits to all of our nursing facilities and checking on those residents to make sure they're being fed, make sure they're being taken care of, their clothes are being changed, they're being cleaned up, all the things that a nursing home should be doing that sometimes a nursing home is not doing. And sadly, we got 1,444 complaints last year. Some of those complaints wind up being referred to the Vulnerable Adult Unit in the Attorney General's office and resulting in prosecutions for abuse or neglect or exploitation. Next division we have is the Division of Community Services. That comes alongside our economic assistance eligibility, and it picks up some of the gaps, if you will, in what TANF and SNAP doesn't do for families. We have the Community Services Block Grant, which provides services to help folks get into housing. It doesn't provide long-term housing assistance, but it helps them get into a housing situation or to secure to get started in an educational program or to get started in a job. Then we have a program you may have heard about called the Low Income Home Energy Assistance Program. And just last month, when we had some of the coldest weather we've had in a long time, our demands for energy assistance went up significantly. We administer that program through the community action agencies all across the state, and we served over 40,000 people last year and dispersed over $31 million in energy assistance. And then, as you might imagine, those who are living in some of the poorest conditions are living in some of the most unkept or oldest housing that we have, and they need weatherization. And so we provide a weatherization assistance program that helps reduce the heating and cooling costs by installing insulation, sometimes by installing new windows, and anything that can make that home more energy efficient. We weatherized about 140 homes last year, spending about $2.1 million doing that. All of our community services programs are funded with all federal dollars. We got about $50 million last year for community services. You're probably familiar with the next division, our Division of Child Support Enforcement. That is, again, one of our larger divisions, probably after economic assistance, I would say, in terms of the number of cases handled, it's our next largest. We had 234,000 plus cases in fiscal year 2022. They do these on an annual basis, a calendar basis, so we don't have the 23 numbers just yet. They're working on finishing those up. We have to locate non-custodial parents and establish paternity before we can establish a child support order for payment. So we located almost 49,000 parents for child support or for child welfare purposes in fiscal year 22. And we have a pretty good success. We established paternity in about 95.5% of the cases where we find a putative parent, predominantly, I'm not meaning to step on any toes, dads, but predominantly those are dads that we're finding and establishing paternity for. We draw down about $31 million in federal funding on a 66 to 34% match of state, federal versus state money. With that money, our Child Support Enforcement Division collected over $366 million in child support payments in fiscal year 2022. And I defy any of my colleagues in any other agency to show me a program that has a return on investment of 12 to 1. We recover $12 for every dollar we spend on this program. And it is top notch. We use an outside vendor called Young Williams that you all may or may not be familiar with, but we stay on them. We added in the last iteration of their contract, we added some measures that allow us to impose liquidated damages on them if they don't meet the metrics in the contract. And I think, Rochelle, we pretty much recoup liquidated damages every month so far. Okay. Well, we don't pay out. One of the measures is we don't pay them if they don't meet the staffing requirements. And so we've saved money by not paying for staffing, and then for some of the metrics that they have not met, we have recovered some liquidated damages. Point is, we're saving money by holding their feet to the fire and making sure that they administer this program and continue to keep it. Our ROI at 12 to 1 is one of the highest. I think we're among the top 5 in the country in terms of the effectiveness of our program, based on what we spend on it and what we collect. And then we also administer in child support the access and visitation program, which is designed to bring non-custodial parents together with the children that they're supporting. I think it's no surprise when I say that parents who have relationships with their children are more likely to stay current with their child support obligations. And in addition to that, it's absolutely true that every child, assuming that it is a positive interaction, every child can benefit from having 2 parents involved in their lives. All right, next division I want to talk about is our Division of Youth Services. This serves youth all across the state who have been adjudicated delinquent by a youth court or who are at risk of becoming a delinquent and finding themselves in our juvenile justice system. We have 2 separate sections in the Division of Youth Services. We have the Community Services section, which operates all across the state. Everywhere you have a youth court judge, as a county court judge who's serving as a youth court judge, or if you have a youth court referee, or if you have a chancellor who is handling the youth court docket. We have youth court counselors who essentially serve as the probation officers, if you will, for those youth court judges. And then the institutional section of our Division of Youth Services operates Oakley Youth Development Center out in Raymond. A lot of times people don't realize Oakley is not only a youth detention facility. We like to think of it as a development center because we're committed to developing new paths for the youth that are there. But it also has a full-time school. The Williams School, we have, Michelle, how many teachers do we have out there these days? Do you know? About a dozen teachers. We run a full-time school. You know, when these youth are adjudicated delinquent, that doesn't mean they're relieved of their obligation to continue their education. And so they continue their education at Williams School, which is on the campus at Oakley. And then we have it's kind of a bare bones medical clinic. We do have a medical clinic. If we have specific needs that our small clinic can't handle, we send those youth to the University Med Center, and we have an existing MOU with University Med Center. One of the things that's a little bit distinctive about our Division of Youth Services is U-Fund through general fund appropriations, essentially everything we do in our Division of Youth Services. And it is about $19.5 million a year, and we served over 7,500 youth in 2022. Now, I want to talk to you briefly about just a couple of other divisions and some recent changes we're involved in. One of the first things I did when the governor asked me to become executive director back in 2020 was I reached out to my friend Sandra Griffith and hired her as our first chief compliance officer. She built a compliance program at NDHS because we didn't have one, which might explain a lot of what happened in the last administration, the fact that we didn't have a compliance officer. She built that compliance program and served as our chief compliance officer for 2 years, I guess, was it? About 2 years. Our inspector general left us and moved elsewhere, and Sandra came to me and offered to step in and become our inspector general, and her deputy, Cameron Harris, moved up to become our chief compliance officer. Part of what our compliance program does is make sure that we're spending the state and federal dollars in accordance with the law. We have a SNAP quality control program that basically checks our homework on all of the eligibility decisions that we make in SNAP cases. SNAP quality control pulls a sample of cases every month, and they go back and check every document, every piece of paper involved in that eligibility determination for that SNAP case. Now, one of the things that we have to keep a watch on is our error rate, because if our error rate is over the national average, then we face potential penalties from the Department of Agriculture. Actually, the most recent number, this says 9.25. It's actually down slightly to 9.03, but that is still over the national average, and we are in a corrective action plan to try to get that back down around 6%. The feds don't care if we have a 6% error rate, but if we're over that, we're facing potential penalties, and the penalties are pretty onerous. They're based on the amount of SNAP money that we distribute, and if we were to face a penalty today, it would be somewhere in the neighborhood of $1.5 to $2 million. We also have a monitoring program. One of the things that was, let's say, overlooked in prior administration was monitoring the sub-grant agreements. And our monitoring program assures compliance with federal law by monitoring every sub-grant as it's closed out and assessing question costs when the sub-grant has not been administered in accordance with the law. And last year they assessed about $2.5 million in question costs through their monitoring process. You actually have the Benefit Recovery Unit listed there. It's part of Sandra's shop, the Inspector General's office. The Benefit Recovery Unit is responsible for monitoring, tracking, and recouping payments, overpayments, resulting from improper payment of benefits. And you see the numbers for last year. We recovered about $422,000 from child care providers. We recovered $4.6 million from overpayments from SNAP and TANF, about $35,000 from subgrantees, and $9,400 more or less from our LAHI program. Last thing I want to mention to you, well, actually next to last thing I should say, we are about to go to ITS to get approval for something we're calling the Success Project. we're replacing some of the oldest, most antiquated computer systems you will ever find. We're using batch processing systems that are written in COBOL and Fortran and natural databases that operate on a command line interface. What does that mean? It means forget about a mouse, because you got to learn function keys and hotkeys in order to run our old systems. And they run these old green screens that you may remember seeing for years and years. Banks use these systems. Some banks still use them. Ours are 35 years old. And thanks to your help, we're near the process of beginning the design, development, and implementation of a $155 million modernization and integration project. It's called Success because it's the strategic update of critical client eligibility systems and software. And yes, I'll take credit. I made up the name Success because I think that's where it's going to take this agency. It's going to take us forward to success. It will allow us to eliminate the time it takes to process a single application from a number of hours to 15 to 20 minutes. And that is huge manpower savings for us, but more importantly, it's a huge savings for our clients if they don't have to come spend 2 or 3 hours in our office if we are able to take their SNAP or TANF or child care or child support application in a matter of 15 to 20 minutes versus 2 to 3 hours. That project is on track. We expect to present our proposal to ITS's board on February 22nd. And as I told Chairman Hobson this morning, actually the $54 million is needing to go up just a little bit to about 59.1 million, but the federal share is going up to about 125 million. So share and share alike. We got the feds to agree to pay more, and we're going to ask you to raise that number up about 5.1 million. That $170, $80 million project will be transformative for this agency. I'm absolutely convinced of that. And speaking of transformation, one of the last things I want to invite you all to do, if you have not looked at our website lately, you haven't looked at our website, because we released a new website just last month, and it does not look at all like anything you've seen before. You will find it very much simplified in the way that you navigate it. You will find it much more client-friendly, user-friendly. You'll find that it will allow you to search within your own county for the resources that are available in your county. It has tabs that ask what you need help with, and then you type in what you need help with. Mark Jones and Claire Graves, our Chief Innovation Officer, they worked hand in hand with our vendor to get this website ready to be released, and I am very, very pleased with our new website, and I invite you to take a look at it. If you don't know where to find it, it's mdhs.ms.gov. And again, I think it's very, very much a needed improvement, and will be much more useful to us and, most importantly, to the clients that we serve. You have in this folder just some eligibility sheets, if you will, that tell you what the threshold is for certain of our programs. And then you have a snapshot page that really captures a lot of what I've been talking about for the last half hour on one page there for you. Mr. Chairman, that's what I wanted to share with you. I'm happy to entertain any questions that the members
Thank you,
may have.
Director Anderson. I must commend you on being able to manage such a vast agency, and even more impressive is your knowledge of all the acronyms.
Thank you.
We'll open it up for questions, but I do have some questions. Do you have offices in all 82 counties?
Yes, sir, we do. And actually, in Bolivar and Sunflower, I believe we have 2 offices. We have 84 offices across the state.
And every program that you mentioned in these 7 divisions is offered in all 82 programs, all 82 counties?
Yes, sir. Yes, sir.
All right. Are those offices open 5 days a week?
If we have the people to staff them, they're open. And I will tell you, my economic assistance staffing is a constant struggle to fully staff. We're actually about 300 short out of a staff of what should be 800 or 900. So about a third of our needed staffing is simply not there right now. But yes, we're open 5 days a week, 8 to 5.
So 1/3 of your staff is not...
1/3 of the authorized staffing we have for county offices, we just can't keep them in the offices. We just recently, last year, got the assistance from the State Personnel Board to transition those folks over to a new career ladder salary plan, and our hiring has been significantly better since the fall of last year. But, you know, we still face a big turnover issue in eligibility staffing.
And your offices, who provides those for you? Is that the county, or do y'all select?
Well, we're kind of at the mercy of the county. There is a statute that says they will provide an office to us, but there's no requirement about what the condition of that office should be. And we have brought forth a piece of legislation this year to allow us to enter into leases with the counties. We can pay them federal funds. We don't pay them anything. And unfortunately, in some counties, we get what we pay for. We've got some offices with, you know, I'll be very blunt, but rodents and squirrels and snakes and mold and, you know, all kinds of different things, simply because the county doesn't have the money or doesn't invest the money in the building that they give us to administer these programs. And we're asking the legislature to give us authority to enter into leases with every county so that we can share, we can pay up to 50% of the cost through our federal matching funds. And we think that would give us the ability to hopefully enter into some leases and have some better offices across the state.
And the last question I have, at least for now, is the school age reimbursement program, the CCPP. It's $25 million, and that's to reimburse child cares who would take an institute. Will that sunset?
Yes, all of those ARPA initiatives will sunset September 30th of this year. We run out of all of that ARPA money. So the substitute teacher pool, the school aid reimbursement, the stipends we're doing for teachers in child cares, and the work we're doing to try to raise up new child care providers, all of that will sunset September 30th.
Questions? Questions? Yes, Senator. Senator Parker.
I think this might be on now. I know, Bob, when we met late last year, you and I had some discussions about the reserve funds in TANF and how those have ballooned over time and how that balance has gotten to be pretty significant. And we had some talks about what we could maybe do using those 4 tenets that give you eligibility or access to those, and as far as food needs or other needs that might be out there. Did your department have any ability to come up with some way to access that, or some way for us to look into programs or other opportunities for the use of those dollars so that they're not just going to be sent back to the federal level?
Yes, sir. We carry those funds forward three fiscal years. Is that right, Wayne? Okay, well, we can carry them forward about 6 years or more. They don't get sent back. We don't have to send them back. That's not at risk. We have funds going back to fiscal year, 2021 right now, still available to us. But yes, we are looking at possibilities, a lot of possibilities of ways that we can utilize those TANF funds. One of the main things we want to use them for is to get out in the counties and try to encourage more people to take advantage of the cash benefit assistance that's available to them. We're going to be doing, starting February 20th, is that right, Mark? We're going to do some town halls all across the state, just explaining to folks that, you know, the TANF program is available to you, and we want to do everything we can to assist you to be a part of that program. We're looking at some other possibilities. We haven't finalized these plans, but things like stepping up what we do for transportation, because I think families who are in poverty, one of the biggest barriers is having transportation. And so we're looking at a transportation program. West Virginia has a program where they rehab vehicles and make those vehicles directly available to families. We're studying that real closely and seeing if that's something we might could do in Mississippi.
And could you tell us what the balance is right now in that TANF fund?
Wayne, what's the number? About 147 million that we have on hand right now.
Right, and that continues to be my concern, is that we have such a large amount in that fund that it kind of can become something where it just could be accessed, you know, inappropriately, which is, I think, some of our problems from the previous administration. And so I look forward to hearing programs like what you're describing, because I do think we need to find a way to use that. And the only way in the four tenets that I see is to use number 4, which is what I think you're describing when you're talking about a transportation program to try to keep a two-person family together.
Yes.
I just don't see any other way to do it. And if we can keep it perpetually, and we are every year spending $30 or $40 million, maybe less than what we're kind of taking into it, I mean, it's just going to continue to build if we don't find a way to use those funds.
Well, I share your concern, although our neighbors to the north ran up a $750 million surplus, and they're looking for ways to spend it down as well. So that, we're not at that stage, thank goodness. They get more money than we do. They're bigger. Tennessee is who I'm talking about.
Well, they can send it to us if they would like. I would be glad to author that bill, and I think I'd get a pretty good bit of support out of that. But, just anything you can come up with that gives us ideas as the legislature to give you the opportunity to use that, I think, we are all looking to try to find a way to make the best use of that money. So.
Yes, sir. Senator Parker, I want to also make it very clear that, my desire is not that we devote more of this money to sub-grants if we can find ways to get these funds into the hands of families that need them. That's my preference. I want to be very clear about that. That's what the money is given to us for, is to support families. And we can support them with the partners that we work with, doing workforce training and training in after-school programs and parenthood programs. We can help families a lot more if we can put money.
We're coming up on 2. I want to get the gentleman from Washington's question.
Thank you, Mr. Chairman. Can I have the person that's in charge of investigating personal care homes for vulnerable adults? I've been given some information that I think if your agency is responsible for that, you need to look into it. It is a great deal of abuse in this. So whoever is in charge of that, I need their name.
Okay. I will put you in touch with our Adult Protective Service and our long-term care ombudsman, Representative Hines. We're glad to do that.
Senator Bryan.
You mentioned new computer system. You just asked ITS to get started on it. They're building this rail tunnel under the Hudson River. They say they'll get it finished in the mid-30s. Which do you think we're going to get first, your new computer system or the rail tunnel under the Hudson River?
Well, the timeline I've set for my folks is January 26th, and I'm expecting it to be ready to go live in January 26th.
But there are 50 states that all do the same thing that we do.
Yes, sir.
Shouldn't there be just some other system that some other state has that we can just get and plug in?
That's what we're doing. We just paid a site visit to Tennessee, and we expect our system to look a lot like what Tennessee uses.
Okay, thank you.
Yes, sir.
My House members have abandoned me, but senators,
I would just say before we leave, if you'll look in the middle of this room, you'll see this column. The column is there to support the room that's on top of this one, and that's where we're going to be tomorrow at 3 p.m. We'll see you all there.
rise and report.
Thank you so much, Mr. Chairman.
Thank you, Director Anderson.
Good to see you too.
Good, you got it.
I think so. I'm gonna figure it out.
Thank you.
Will, is the deputy.